How to stop a child from choking. Choking in young children most often happens while they're playing or eating. Children, particularly those aged from 1 to 5, often put objects in their mouth. This is a normal part of how they explore the world. Some small objects, such as marbles, beads, and button batteries, or just the right size to get stuck in a child's airway and cause choking. The best way to avoid this is to make sure that small objects like these are kept out of your child's reach. To avoid choking while eating, always cut food into small pieces before giving it to your child. No matter how careful you are, your child may choke on something. In most cases, you or someone else will see your child swallow the object that causes choking. But if your child suddenly starts coughing, isn't ill and has been eating or has a habit of putting small objects in their mouth, there's a good chance that they're choking.
Tips on helping a choking child. If you can see the object, try to remove it. Don't poke blindly or repeatedly with your fingers. You could make things worse by pushing the object further and making it harder to remove. If your child's coughing loudly, encourage them to carry on coughing to bring up what they're choking on and don't leave them. If your child's coughing isn't effective, it's silent, or they can't breathe improperly, shout for help immediately and decide whether they're still conscious. If your child's still conscious, but they're either not coughing or their coughing isn't effective, use back blows or chest thrusts. Babies under 1 year, or back blows or abdominal thrusts. Children over 1 year, you may need to use more than one method to stop choking. It doesn't matter which order you do them in. If one method doesn't work, try the other method. Keep trying each method until the object comes out. How to give back blows. Chest thrust and abdominal thrust. To use back blows for babies under 1 year, sit down and lay your baby face down along your thigh or forearm, supporting their head and neck with your hand. Give up to 5 sharp back blows with the heel of your hand in the middle of your baby's back between their shoulder blades. If the object has come out between each blow, you may not need to use all 5 blows to use back blows for children over 1 year. Lay a small child face down on your lap. You would a baby. If this isn't possible, support your child in a forward-leaning position and give 5 back blows from behind. Of back blows don't relieve the choking and your baby or child is still conscious, give chest thrusts to babies under 1 year or abdominal thrusts to children over 1 year. This will create an artificial cough, increasing pressure in the chest and helping to dislodge the object. To use chest thrusts for children under 1 year, lay your baby face up along the length of your thighs with their feet closest to you and their head furthest away and lower than their feet. Place 2 fingers in the middle of their chest just below the nipple and give up to 5 sharp chest thrust pushes. Check to see if the object has come out. Between each thrust, you may not need to use all 5 thrusts. To use abdominal thrust for children over 1 year, stand or kneel behind your child. Place your arms under the child's arms and round their upper abdomen. Clench your fist in place. It between the navel and ribs. Grasp this hand with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check to see if the object has come out between each thrust. You may not need to use all 5 thrusts. Make sure you don't apply pressure to the lower rib cage, as this may cause damage.
Child and baby CPR. Steps 1. Ensure the area is safe. Check for hazards, such as electrical equipment or traffic. 2. Check your child's responsiveness. Stimulate your child and ask loudly, "Are you all right?" 3. If your child responds by answering or moving, leave them in the position they were found in, provided they're not in danger. Check their condition and get help if needed. Reassess the situation regularly. 3b. If your child does not respond, call for help. Carefully turn the child on their back. If the child is under 1 year old, ensure the head is in a neutral position with the head and neck in line. At the same time, with your fingertips under the point of your child's chin, lift the chin. Do not push on the soft tissues under the chin, as this may block the airway. If the child is over 1 year old, open your child's airway by tilting the head and lifting the chin. To do this, place your hand on their forehead and gently tilt their head back. At the same time, with your fingertips under the point of your child's chin, lift the chin. Do not push on the soft tissues under the chin, as this may block the airway. If you think there may have been an injury to the neck, tilt the head carefully, a small amount at a time, until the airway is open. Opening the airway takes priority over a possible neck injury. 4. Check their breath and keeping the airway open. Look, listen and feel for normal breathing by putting your face close to your child's face and looking along their chest. Look for chest movements. Listen at the child's nose and mouth for breathing sounds. Feel for air movement on your cheek. Look, listen and feel for no more than 10 seconds before deciding that they're not breathing. Gasping breaths should not be considered to be normal breathing, 5A. If your child is breathing normally, turn them on their side. Check for continued breathing. Send or go for help. Do not leave your child unless absolutely necessary. 5B. If your child is not breathing or is breathing infrequently and irregularly, remove any obvious obstruction in the mouth. Give 5 initial rescue breaths, mouth-to-mouth resuscitation. While doing this, note any gag or cough response. This is a sign of life.